This video log or vlog is on artificial results. You probably always wonder what's going on. You go to a cocktail party and see this friend of yours, you say, God, that person just looks weird. I don't want to have that. So I'm going to give you sort of a top 10 things of what looks weird, and your eye may not even perceive it. I always like to tell these stories where, example is I have a patient coming in wanting a facelift and their nose just looks off. And I can't help but mention this to them. And they go, really? My nose looks off? And they don't even see it. And the reason they don't see it is the fact that your standard of naturalness is only here. You're catching all these cocktail party problems here. My standard of naturalness is this high. So I'm going to try to fill this gap and tell you the things that you should look for that don't look right. And also for you to understand the things I try to avoid and why. And I'm going to go through just from hairline all the way to neck, the things that are obvious why things are off and how I try to avoid those areas. Another story I love is I was sitting in San Diego at a meeting, sitting next to a colleague, and we were watching actually this lecture on really bad facelift results. And well, the gentleman was saying he had good facelift results, but they were actually quite fake looking to me and to everyone else. And the gentleman next to me says, well, I can always tell a fake hair transplant result. And I said, the gentleman in front of you has a transplant, the gentleman in front of you has a toupee or a hair system, and the gentleman to the next of you has a crown transplant. And he goes, really? I can't see those two. I said, well, it took me years to understand those deficits. So with that in mind, I'm going to start from here to here and just briefly talk about the top 10 reasons why things don't look right. So for the hairline, I think all of you know if you see big plugs. I don't have to even tell you that. That's too obvious a comment. But some of the things, when you look at it and you may or may not perceive it that doesn't look right, besides having too straight a hairline, is a few things. For a gentleman, typically the hairline doesn't dip this way. So when I teach students how to draw hairlines, the hairline should go up a little bit for men, or maybe straight, but not down. That's more of a female pattern. So that's one of the telltale signs something may be off. The other big thing for me is matching the temporal points to the hairline. So sometimes you get this hairline that's here and the temporal hair is back here. It looks like a hair system or hair piece. And that's one of the ways I actually fix people that want a hair piece, if they don't have enough donor hair to rebuild the whole hairline, is just to move and migrate the temporal point up to match it so everything looks right. So that's one element of the hair. Going down, the brows. So clearly everyone knows the startled appearance. I really believe the new understanding of the brow today is that they should not be very high. I occasionally will do a very slight temporal lift, but it's not on a norm, because part of the thing is I believe that brows should be relatively low. They become empty, and that emptiness around the eyes is really something that should be treated rather than just evacuation elevation. So that's in my other videos. I go into more detail with that. One of the big things, and I shot this video maybe 12 years ago, 13 years ago, is weird eyes. And for me, the canthus, this part right here, where the joining of the upper and lower eyelids, when this area gets distorted, people look weird. So it's either pulled in, pulled out, pulled up, pulled down. And that's why I don't release this area. So a lot of people free up the canthal position, and when there's this distortion at this canthus, it can either look like a cat eye, it can look droopy dog, it can look blunted, which is weird because when the shape is no longer a V but it's rounded in, it makes your eye look at it and say something is not quite right. So I never cut on that canthus. I never release it. When I go lower eyelid, I do what's called transconjunctival. There's no incision. So moving and migrating this canthus is a real problem. Noses. I'll break it down into the bridge, the tip, and the sides. The bridge, the biggest problem is a scoop nose. So I like what my mentor told me is that God never created scoop noses, only man did. So a nose should not look like this, okay? This is a saddle deformity, and a lot of people that reduce bridges, they take it too far down, which doesn't look natural, especially when you're dealing with Middle Eastern noses that look way over-reduced. It also sometimes just makes a tip look huge because you've over-reduced the bridge. So all you've got to do is a straight reduction, and that reduction of the bridge, a lot of people think, oh, it's just a little rasp here. No, the entire bridge, not always, but in the entire bridge is often the hump where you got to just take a little bit all the way down. So avoiding a scoop nose. The tip, a pinch tip. Now there's all different types of tip deformities. I'm not going to get into that. But one of the telltale signs is the nose that looks like a uni-tip, where if a natural nose, a lower lateral cartilage, or the cartilages that make up the nostril should look like two curves. So when you bind them together to create this tip that looks like a single tip, that is a telltale sign that a rhinoplasty was done. So that's one of those things that looks weird. Now clearly notch nostrils don't look natural either, so I can briefly mention that. The other thing is that on the ala, so when this outer curve of the nose looks like a slit, that's a telltale sign. So there's an element of the nose called the nasal sill. The nasal sill is a curvature that ends on the face, like a windowsill. When that nasal sill is cut and violated and there's a sharp corner at this point, it looks like you've had an alar base reduction. So what I do is what's called a Sheen flap, which by Jack Sheen, which when you reduce this area, you maintain the curvature, you don't violate the nasal vestibule, which is inside the nose, and you retain the curvature. So that way it doesn't look like the entire Jackson family that has those slits down here on the bottom of the nose. Lips, so clearly there's a whole video on lips, but the biggest thing for me is poor shape of the lips, too much border, and the lips don't match the face. So he's got these large 25-year-old lips when the person is actually 45. It looks weird. The lips have always got to trail or follow the face, not the other way around. So that's important. The cheeks, this is huge, well, it shouldn't be huge, but it's a huge point, which is the fact that now I've begun to realize that the anterior cheek and the buccal zone, this whole zone right here, when you smile, it looks like a big mess. So what I try to do now is avoid all fillers in the central face. Buccal I do, but now my trick is if I want to fill the buccal, I just hit the bone transition where it dips in the buccal. Sometimes I got to put some in the buccal, but this central zone is an avoidance area. So there's a whole 26-minute consultation where I talk about how I frame faces and how I do fillers, and again, I'm not going to belabor the point, but the key, and I just did a fat transfer this morning while I'm in scrubs, is that the outer face, where the zone that's starting to hollow out where my hands are, that's how you get someone looking young and not crazy, because big cheeks don't make someone look younger, they just don't look quite right. Then with facelifts, besides pixie ear deformities and other things that are obvious, for me, what a big thing is, as much as the canthus is a problem, the commissure, which is the juncture of the mouth here, when this area looks bunched and changed, it makes someone look weird. So I never release this zone because I think it makes people look weird. The other thing is a lateral sweep. So when people don't have the right vectors of pull, then the skin, because the operation is a muscle pull, but when the skin is not redraped properly, then it looks slightly weird, and that lateral sweep is a telltale sign of a overdone facelift. The ears, so overpinned ears. So the ears should have a little bit of what's called helical show, which means that the helix, which is the outer border, should have some visibility and not have it go all the way back in. So that's something, these are quick, obvious points that to me are obvious. It may not be obvious to you, but when you're looking and trying to figure out why at that cocktail party does that woman just not look right, usually that top 10 list is maybe over 10 points, but those top 10 points of around the face are usually signs of what makes someone not look natural.